10 signs your feet tell you about diabetes. Have you ever looked at your feet and wondered if they might be trying to tell you something about your health? Believe it or not, your feet can reveal early warning signs of diabetes, long before you ever get a blood test. From numbness and burning pain to slow-healing wounds and strange skin changes, these signs can be easy to overlook but dangerous to ignore. In this video, we'll uncover 10 important clues your feet might be showing right now that could indicate diabetes or poor blood sugar control. Catching these symptoms early can make all the difference in preventing serious complications down the line. If you're serious about protecting your health and learning practical tips to stay one step ahead of chronic disease, hit the subscribe button and tap the notification bell. We post new, eye-opening health content every single week, and you won't want to miss it. Sign number 1, tingling or numbness in your feet. One of the earliest and most common signs of diabetes-related nerve damage is a tingling or numb sensation in the feet, especially in the toes. This condition is known as diabetic peripheral neuropathy, a type of nerve damage caused by prolonged high blood sugar levels that impair the tiny blood vessels supplying the nerves. People with this condition often describe the feeling as pins and needles, burning, or even a crawling sensation under the skin. Over time, this numbness can become more severe, eventually leading to a loss of sensation in the feet. That's particularly dangerous because it makes it harder to feel injuries, blisters, or infections, which can worsen unnoticed. According to the Centers for Disease Control and Prevention, CDC, about 50% of people with diabetes have some form of nerve damage, and the feet are among the first areas affected. Diabetic neuropathy not only increases the risk of foot ulcers and infections, but can also lead to serious complications like gangrene or amputation if not managed properly. If you're experiencing tingling or numbness, especially if it's persistent or worsening, it's crucial to speak with your healthcare provider. Early diagnosis and blood sugar control are key to slowing or preventing nerve damage. Sign number 2, cold feet even when it's warm. Consistently cold feet, even in warm environments, may be more than just poor circulation. It can be a warning sign of diabetes. This symptom often stems from peripheral artery disease, PAD, a condition where the blood vessels narrow or become blocked due to a buildup of fatty deposits, limiting blood flow to the limbs. People with diabetes are at significantly higher risk of developing POD due to chronic high blood sugar damaging the blood vessels over time. When blood flow is restricted, the extremities, especially the feet and toes, can feel cold, numb, or weak. In more severe cases, poor circulation can contribute to cramping, changes in skin color, and even slow-healing sores, increasing the risk of infection and ulcers. According to the American Diabetes Association, individuals with diabetes are 2 to 4 times more likely to develop PAD compared to those without the condition. Cold feet alone aren't a definitive sign of diabetes, but when combined with other symptoms like numbness, tingling, or foot pain, it becomes a strong indicator to consult a healthcare professional. If your feet are frequently cold regardless of the weather, it's essential to get a full vascular and diabetes screening. Early intervention can prevent serious complications such as infection or limb loss. Sign number 3, slow-healing wounds on the feet. Slow-healing wounds on the feet, such as cuts, blisters, or scrapes, can be one of the most visible early warning signs of diabetes. Chronically elevated blood sugar levels can cause damage to both small blood vessels, microangiopathy, and peripheral nerves, neuropathy. This dual damage significantly reduces the body's ability to deliver oxygen and nutrients to injured tissues, while also impairing the sensation of pain or discomfort. When the feet are injured, whether by tight shoes, minor trauma, or dryness, people with diabetes may not notice the injury due to sensory loss. As a result, wounds may go untreated for longer periods, allowing infection to set in. Reduced immune function, another consequence of poorly controlled diabetes, means that the body is less capable of fighting off bacteria, fungi, and other pathogens. According to the American Diabetes Association, foot wounds that don't heal within 7 to 14 days should be evaluated by a healthcare provider. These wounds are not just a nuisance, they are a serious health risk. Up to 15% of people with diabetes will develop a foot ulcer, and of those, nearly 1 in 4 will require some form of amputation if the wound becomes infected or necrotic. Routine foot inspections, good hygiene, comfortable footwear, and strict blood sugar control are essential steps in preventing these complications. Early detection can save limbs and lives. Sign number 4, dry, cracked skin on the feet. Dry, cracked skin on the feet, especially around the heels, is more than just a cosmetic issue. For individuals with diabetes, it can be a sign of underlying nerve damage that affects the skin's ability to stay moisturized. When the nerves that regulate sweat and oil glands are impaired, a condition known as autonomic neuropathy, the skin becomes dry, rough, and prone to cracking. Cracked heels can lead to open fissures, which create an entry point for bacteria and fungi. This increases the risk of infections, especially in people with diabetes whose immune systems may be compromised. What starts as a minor issue can escalate into serious skin infections or foot ulcers if not properly managed. In addition, dry skin is often more susceptible to irritation and inflammation. Diabetics may not feel the early signs of skin damage due to sensory neuropathy, allowing the condition to worsen unnoticed. This is why daily foot inspections are recommended, particularly for those who have had diabetes for several years. Moisturizing regularly with fragrance-free, non-alcoholic creams and avoiding walking barefoot are simple but effective preventive measures. If skin dryness persists or worsens, it's important to consult a healthcare provider. Treating dry skin early helps maintain the protective barrier of the feet, reducing the risk of infections and further complications. Sign number 5, frequent fungal infections. Frequent fungal infections, such as athlete's foot or toenail fungus, can be more than just a hygiene issue. They may signal uncontrolled diabetes. Elevated blood sugar levels create an environment where fungi thrive, especially in warm, moist areas like the feet. The immune system in people with diabetes is often compromised, making it harder to fight off infections. Athlete's foot, caused by the fungus Tinea pedis, typically presents as itching, burning, redness, and flaking skin between the toes. Meanwhile, fungal nail infections, onychomycosis, may cause the nails to become thick, discolored, brittle, or crumbly. These conditions can be persistent and difficult to treat without medical intervention. When fungal infections are left untreated, they can lead to more serious complications, especially in diabetics. Skin breaks from scratching or cracked nails can serve as entry points for bacteria, leading to secondary infections that may spread quickly due to impaired circulation and nerve function. According to the CDC, proper foot hygiene is critical for people with diabetes. This includes keeping feet clean and dry, changing socks daily, and using antifungal powders or sprays as needed. If symptoms persist, a healthcare provider may recommend oral antifungal medications or debridement of infected nails. Early treatment helps prevent escalation into more serious issues like cellulitis or ulceration. Sign number 6, burning or sharp pain in the feet. A burning or sharp, stabbing pain in your feet, especially at night, can be a sign of diabetic neuropathy, a type of nerve damage caused by prolonged high blood sugar levels. This condition affects the peripheral nerves, particularly those in the legs and feet, and is one of the most common complications of diabetes. People with diabetic neuropathy often describe the sensation as shooting pain, electric shocks, or extreme sensitivity to touch. Even a light sheet brushing against the foot can be unbearable. These symptoms may start mildly but can intensify over time if blood glucose remains poorly controlled. Neuropathic pain results from the damaged nerves sending faulty signals to the brain, sometimes interpreting normal sensations as painful. The condition may also lead to numbness or a complete loss of feeling, which increases the risk of unnoticed injuries and infections. The American Diabetes Association estimates that around 50% of people with diabetes will experience some form of neuropathy during their lifetime. Unfortunately, there is no cure, but early detection and tight blood sugar management can slow its progression and reduce the severity of symptoms. Treatment options may include prescription medications like anticonvulsants or antidepressants, physical therapy, and lifestyle modifications such as improved diet and regular exercise. If you're experiencing unexplained foot pain, don't ignore it. Consult your healthcare provider for a comprehensive evaluation. Sign number 7, foot ulcers. Foot ulcers are one of the most serious and visible complications of diabetes. These open sores or wounds typically develop on the bottom of the foot and are often caused by a combination of nerve damage, neuropathy, and poor circulation, both of which are common in individuals with diabetes. Due to neuropathy, many diabetics lose the ability to feel pain or pressure in their feet. This means they might not notice a blister, cut, or callus that has formed and worsened over time. Add poor blood flow to the mix, and the body struggles to deliver the nutrients and oxygen necessary for proper healing. This can result in wounds that linger for weeks or even months. According to the American Diabetes Association, about 15% of people with diabetes will develop a foot ulcer during their lifetime, and foot ulcers precede 85% of diabetes-related amputations. The risk is especially high for those who have had diabetes for many years, or who also have kidney disease, heart disease, or vision loss. Prevention and early intervention are key. Regular foot exams, daily self-checks, wearing protective shoes, and seeing a podiatrist can greatly reduce risk. If a foot ulcer does appear, it must be treated promptly and aggressively to prevent infection and protect the limb from further damage. Sign number 8, redness, swelling, or discoloration. Redness, swelling, or skin discoloration on the feet may indicate an underlying infection or inflammation, both of which are concerns for individuals with diabetes. These visible changes can be early signs of cellulitis, abscess formation, or even deep tissue infection, especially when they appear suddenly or worsen over time. Diabetics are particularly susceptible to infections due to compromised immune function and impaired blood flow. When circulation is poor, white blood cells struggle to reach affected areas and fight off pathogens effectively. Red or purple patches, warmth, and tenderness around the site may all point to an ongoing infection that requires medical treatment. In more advanced cases, swelling in the feet or ankles can also indicate Charcot foot, a rare but serious complication where bones weaken and collapse due to severe neuropathy. This condition can lead to permanent deformities if not addressed early. According to the American College of Foot and Ankle Surgeons, any sudden change in the appearance of your feet, especially accompanied by pain, fever, or fluid discharge, should prompt immediate medical attention. Delaying care can lead to rapid deterioration, tissue damage, or systemic infection. Monitoring your feet daily and noting any color or shape changes is vital for early detection. Keeping blood sugar levels within target range and seeking prompt treatment can help avoid irreversible complications. Sign number 9, changes in foot shape or structure. Changes in the shape or structure of your feet can be a serious warning sign of long-term diabetic complications. Over time, chronic high blood sugar levels can lead to nerve damage and muscle weakening, which may cause the bones, tendons, and joints in the feet to shift or collapse. One of the most concerning structural complications is Charcot foot, a condition where the bones in the foot weaken and eventually fracture or dislocate. As the condition progresses, the foot may take on an abnormal shape, such as a rocker bottom deformity. Because of reduced sensation, many individuals don't feel the fractures as they occur, which delays treatment and worsens the outcome. Other visible deformities include claw toes, hammer toes, or dropped arches, often due to an imbalance in the muscles and tendons caused by neuropathy. These changes increase pressure on certain parts of the foot, making ulcers and calluses more likely to form. According to the American Diabetes Association, these types of deformities significantly increase the risk of wounds, infections, and eventual amputation if not properly managed. Early intervention can prevent these issues from escalating. Properly fitted orthopedic shoes, routine podiatric checkups, and diligent blood sugar control can help maintain foot integrity and mobility. If you notice changes in foot shape, don't delay. Seek professional care immediately. Sign number 10, dark patches of skin. Dark patches of skin, especially around the toes, ankles, or tops of the feet, may be a sign of a condition called Acanthosis nigricans, which is often associated with insulin resistance in type 2 diabetes. This skin condition causes areas to become darker, thicker, and sometimes velvety in texture. Acanthosis nigricans commonly appears in skin folds, such as the neck, armpits, and groin, but it can also develop on the feet. Although not painful or itchy in most cases, The discoloration is a visible sign that the body's not responding properly to insulin. Insulin resistance means your cells are less sensitive to the hormone insulin, causing the pancreas to produce more of it to manage blood glucose. This hormonal imbalance can trigger the growth of skin cells and increase pigmentation in certain areas. While Acanthosis nigricans itself is not dangerous, it is a red flag for underlying metabolic issues, including prediabetes or diabetes. If you notice unexplained dark patches on your feet or ankles, especially if accompanied by other signs like skin tags, weight gain, or fatigue, it's important to consult a healthcare provider. Managing blood sugar, maintaining a healthy weight, and adopting a balanced lifestyle can help reduce the appearance of these patches and improve overall insulin sensitivity. Your feet might seem like the last place you'd look for signs of diabetes, but as you've just seen, they can be one of the first places your body tries to alert you. From tingling sensations to skin discoloration, each symptom is a message you shouldn't ignore. If you noticed any of these signs in yourself or someone you love, now is the time to take action. Talk to your doctor, monitor your blood sugar, and take care of your feet before small problems become serious. Drop a comment below if you've experienced any of these symptoms, or if you have questions you'd like us to cover in future videos. And don't forget, hit that subscribe button, give this video a like, and turn on the bell so you never miss another life-saving health tip. Thanks for watching, and take care of your health, starting from the ground up.